Welcome to Shop Talk with Cassandra Renee. With me is my co-host, Kevin Eaton.
Yay, yay. Good morning, Baltimore.
Hey.
Good to be here again another Monday morning, huh?
Oh, yeah. You know what? I'm loving that shirt you're wearing,
Well,
Kevin.
thank you. Well, thank you.
Woo!
Yes, some guys don't like wearing pink and colors like that.
Hey, that's a confident man.
Yeah, well, yeah, no, I'm the man,
Oh, man.
The worldwide least talked about co-host.
That's you.
I'm on the show with the most.
Yes, that's me.
Indeed.
Yes, we are thrilled to have the guests from the Baltimore City Cancer Program back with us for part 2. Today we are going to be discussing cervical cancer, we're going to be discussing breast cancer and prostate cancer because September is Prostate Cancer Awareness Month. So we have with us in the studio today Rhonda Silva, we have Rhonda Boozer-Yeri, and we also have a cancer survivor, Meredith White, and we expect to get a call in from Dr. Shawnee Nateri. Welcome, guests.
Welcome.
Thank you.
So happy to have you here.
Indeed, indeed.
I wanted to have prostate first, but we haven't, the doctor hasn't called in yet. So let's start off by talking about breast cancer. Okay. What is breast cancer?
Well, breast cancer is when there is an abnormality that can be found in the breast. And with further exam, it could be a lump, it could be something that's red, it could be just an area that the woman has noticed to change in one or both of her breasts. And when that happens, we encourage women to seek medical advice. And upon medical advice and having a clinical breast exam by the examiner or by the clinician, they normally will send that patient on for either regular screening mammogram, but most likely a diagnostic mammogram. And at that point is when we move forward with other diagnostic procedures if necessary.
Okay, so is that how it's detected? Because that was my next question.
It can be detected by the woman herself.
Okay.
Seeing that, and that's why we encourage women to know their body, to do these breast exams on a monthly basis, because it's you, it's the woman who will know better than anyone if there's been any changes. So sometimes the woman can find a change in their breast, a lump or something that looks distorted. And you can look at yourself in the mirror to look and see the difference in both of your breasts and to see if there's symmetry or asymmetry going on. We encourage women to do that.
So is there a certain time of the month where a woman should,
Well, we encourage
examine
women to normally do your breast exams usually after your monthly cycle.
Okay.
And you can do it in the shower. We have shower cards that give you examples, but we want you to pick some time every month in which you're going to take the time, 5 minutes, that's all we ask, 5 minutes to touch your breast and see if there's any changes going on.
Okay. What can be done to reduce the risk?
Annual screenings,
Okay.
getting the word out to women and men to inform you about those annual screenings that are so important and those monthly exams that the woman or man should be doing. That's how we encourage folks to do that, and then you will know if there's something that's coming up or something that's developing that's possibly new.
Yeah, because I'm glad you brought up the fact that men can get breast cancer as well, because who is at risk?
Men and women are at risk.
Okay.
There have been known that when men have had cancer, breast cancer. Richard Roundtree is one who had cancer some time ago, and we've had 3 men in our program last year. Unfortunately, they did not have cancer, but they presented symptoms and signs of one of their breasts that we were concerned about, and they were concerned about.
Is there any age a woman should start with her breast exams?
You really should start as soon as you start having a menstrual cycle. We're encouraging women as young as in their early 20s, because how are you going to get to know your breasts if you don't begin touching them? And we're encouraging them to touch them as soon as possible so that they'll know of any changes that may go on in their breasts down the road.
Okay, what are the treatments?
There's several treatments because it depends on the size, the stage. Some treatment can be just chemo or radiation. Some treatment can be surgery or a mastectomy, a removal of the breast. It depends on the size, the stage, and the type.
Mm-hmm.
So there are many treatments. They're very different, and of course, once you're diagnosed with cancer, they gear your treatment toward the type of cancer that you have.
Okay.
Okay. Well, I'm very glad you mentioned about men having breast cancer also, because I wanted to That was one of the questions that I had. And since we're on the topic of the men, how will the men know when to start? Because we don't go through that.
Well, normally men don't. Usually what men will find is that they see a change, because of course men are not doing their breast exams once, because you don't. And so a lot of times men are see the changes by either taking a shower, looking in the mirror, or feeling a change, or they may feel a lump.
So this is something physical. You can actually physically see this.
Sometimes for the men that we've seen, yes, they felt a change in their breast, or they felt a lump in their breast.
Okay. How about the age for the men? Is there a certain age for the men that they
There's-
start?
Cancer will attack anyone. There's no age limit.
Okay. We're talking about breast cancer. Right now we're going to stick with the breast cancer.
I'm
right?
talking about breast cancer. I'm
Okay.
sorry. I am talking about breast cancer.
Okay.
Yeah.
Okay. All right.
I know you mentioned earlier about, there are different treatments, and it really depends on the type of cancer and everything. But what are the side effects to the various treatments?
Well, I'm sure Meredith can tell us some of those. Some of the side effects is nausea, vomiting. They're also called chemo brain, or where you may forget things. Hot flashes are one of the major signs. Hair loss is another one, but the major ones is the nausea and the vomiting, and some of the memory loss.
Okay, can you add anything to that, Meredith?
That's the basics of what happens when you're taking, going for taking this medicine, this chemo and radiation. You'll go through these changes, and that's a normal sign. It's gonna happen. You're gonna lose your hair. You're gonna get sick. And you try your best to go through it and counteract it the best you can, and ask your doctor. There's some ways to counteract your nausea. What can you take? What can you do? And it's not easy, but you'll get through it.
Okay, so how was your cancer discovered?
My cancer was discovered. I yearly do my yearly mammograms, right? And this particular time, I couldn't find the facility that was going to close down. So I happened to be in the village one day, and I saw University Care, which is where we are, our program is. And I walked in. I just walked in by chance. And believe it or not, that particular day, they started their screening. Honestly, I walked in there, I told him what I wanted the mammogram, because I always keep up with this, because I was fibristic. They said, come right in. They were very helpful. This program works for me. And honestly, they took me that same day, and when I went for a screening down at University Hospital, the doctors immediately found what was going on with me.
Wow.
Yeah.
How long ago was that?
It's been
We on the
9
same
years.
show, huh?
Yes, it's been 9 years.
9 years.
Congratulations.
Yes, it's been 9 years. Yes.
Excellent.
Yes, indeed. And I'm grateful. And I tell women, I speak to, young adults, and I tell these ladies, don't believe the myth of what you hear about a mammogram.
Mm-hmm.
What's a pinch, to your breast to save your life?
Yes.
You know what I'm saying?
Mm-hmm.
Don't listen to, oh, it hurts, it's this. It's about you.
Right.
It's about you. You need to get this mammogram done. This not only with the young adults, but some of the older ones.
Right.
I speak with them. I tell them, have you ever had a mammogram? No, I'm not getting you. Yes, you are. Yes, you are.
Right.
You need to get a mammogram. It's very essential.
Right.
To your health, your survival.
Definitely.
Mm.
Because I had my first mammogram last year, and I was a little bit late in that. I have to admit that I was one of those people. And it was a little uncomfortable. That's the most I could say, a little uncomfortable for a short period of time. But like you mentioned, it's your life.
It is.
It's your future. So
Absolutely.
So does cancer tend to run in your family? Is there family history?
You know what? No.
Oh.
No. Not at all. There was no cancer in my family. Not ever in my family that I knew of.
Okay.
At that time.
Wow.
Yeah, so I wondered myself. I said, well, wow, what's going on? It's scary.
Yes.
But then you have to buckle up your shoelaces and determine you're going to live or you're going to die.
Yes.
What do you want to do? You got to help yourself.
Exactly.
Do what the doctors say, go through the changes, go through the medical procedures, and then first of all, you got to have faith.
Yes.
You've got to have faith. It's going to be fine. I'm going to get through this. You gotta get that mindset.
Yeah.
You know, it's about you, no one else, and no one but your God, and you can get you through this.
That is so true.
Absolutely.
If you'd like to contribute to the conversation, our telephone number is 410-481-1010. Again, that's 410-481-1010. If you have any questions or comments for our guests in the studio today.
And also personally, on behalf of Shop Talk with Cassandra and Renee, I'd like to really thank you guys for coming in. The last show that we had, I mean, I have, I guess, what you call co-host intuition, but I just honestly have this intuition feeling that you guys actually saved a listener's life the last time we were here.
Yes.
You know, that's how you guys impacted the airwaves last time you were here. And, you know, we had callers coming in. I believe that, you know, you guys actually helped somebody last time. So,
We did.
Yeah, talk about what happened.
Well, we had a phone call from right after we got back to the program. We did have a phone call where someone did call in and voice their concerns while we were on the radio show.
Mhm.
And they called our program and were setting this gentleman up for a colonoscopy exam.
Wonderful.
See, that's what
So
I'm
we
talking
thank you.
about.
That's rewarding. You know, it makes me feel good, like we're doing something positive.
And
So-
he has symptoms, so we're really happy.
Yeah.
Good. That is excellent. That is excellent.
Because we were concerned about him when he called.
Yeah,
Yes,
yeah.
He made that call to
Mhm.
you.
Yeah. Yeah.
What are clinical trials?
Clinical trials are normally, at university, I can speak of university, we normally want the young lady or the breast cancer survivor to go into some type of trials because what we want to do is to zero in on that particular cancer. And if the medication that is on trial at the hospital may and may not work for that young lady, what we do is we put them in the trial. It depends on the type of cancer again. It depends on the type of medication they're using underneath this clinical trials. And clinical trials are normally something that is used for, that we're trying out to see whether or not will this make an impact on this particular population, this particular cancer population, and what in the future could this possibly do for other women down the road for the medication that they possibly are using in this clinical trial? What benefits may it have?
I have a question. How about diet? Does diet make a difference in environment? Like maybe somebody lives close to a nuclear plant or airport or something like that?
Well, diet is always important with just any type of healthcare, any type of disease anyway, so it's important, of course, that you eat your vegetables, stay away from the things that don't agree with your body, and I'm not a vegetarian, I like red meat, but there are those who say, of course, to stay away from red meat and different things like that. I can't specifically speak to any type of plants. I do know, however, that some folks who live close to towers, if you will,
Radio towers?
radio towers, that may not be safe. It's interesting, as we were looking to buy, don't live here. You talk to any doctor, they say don't live near a radio tower. However, I am not a medical professional, I'm a health educator, so I can't speak to that, but as always, you should always look at your environment and the things that are around you, whether you smoke or not, whether you're around a smoker. We know the secondhand smoke is sometimes more dangerous than smoking ourselves, but it's always important to not just look at the disease itself, but to look at our environmental factors, whether it be diet, whether it be the air that we breathe, extremely important, and warding off a lot of disease, not just cancer or breast cancer.
And what about plastic containers? You know, because sometimes you hear about the use of plastic containers.
You know what? I think that we hear so much that if we take it all in, we'll be running around here like crazy people. So, you know, sure, there are certain toxins in probably everything that we take in. So you have to use your good judgment and good sense. Again, I can't speak to what is in every piece of Tupperware or Rubbermaid piece that we use.
Right.
Some people prefer to take their things out of the Tupperware and heat things on a plate.
Right.
Whatever works for you. But I don't know if there have been cases where you've actually been able to point to a piece of Rubbermaid and say, this is what gave me cancer because I
Right.
used this and heated my food up in this all of the time. But if you want to be extra careful, sure, take your food out of the Rubbermaid, but I'm not here to say that that will cause cancer.
Right.
But if you want to be extra cautious,
Yeah,
sure.
and for peace of mind.
Certainly.
I have a question. A lot of people now use microwave a lot instead of conventional cooking. Does the microwave food affect, you know, the cancers, anything like that? That you know of?
Again, not to my knowledge.
Okay.
However, for those who want to be extra cautious, I have to say I've not had a cancer diagnosis before, so I use my microwave on a regular basis.
Okay.
However, that may change if I were to have a diagnosis.
Okay.
Some people prefer to heat their food in the oven or to put it back on top of the stove. I really can't speak to that, but it's really, you have to do what you feel is best for you. I don't have statistics here that say that if I use a microwave, I'm going to get cancer. Or
Okay.
if I have cancer and use a microwave, it's going to
Totally fine.
exacerbate it.
Okay.
I don't have those type of statistics. So it's really using your own judgment without driving yourself absolutely bananas.
Mhm.
And are there complementary holistic medicine, medical type treatments that are recommended sometimes for people?
I don't know if they're recommended, but they're certainly out there.
Okay, so
Sometimes,
what are they?
sometimes they will actually, I don't want to say go against traditional medicine, but for lack of a better word, go against traditional medicine. So
Okay.
again, we always have to take control of our own stuff.
Right.
Holistic medicine may work for me, it may not work for Meredith, it may not work for Rhonda. It really depends, but certainly there are holistic treatments. Most of the time, they're not covered under an insurance plan.
Okay, right.
So you're going to pay a whole lot of money. They'll fly you out to California to these certain centers, you know, saying that they can help with your cancer treatment. I'm not here to say whether it helps or not. Again, you know, it really is up to the particular patient. But all of the time, it doesn't always complement
Right.
traditional medicine.
Okay. You know, because speaking of, I guess, the financial part of it, are there any assistance programs that kind of help with the treatments?
Well, woo-hoo, here we are.
Okay.
We're the Baltimore City Cancer Program, and we do,
Okay.
in fact, offer free services to
Okay.
city residents who don't have health insurance. We do free mammograms, free clinical breast exams, free pap smears, and free colonoscopies
Okay.
to patients who are uninsured or underinsured. The
Okay.
awesome thing about our program is that not only do we do the screenings, but if a cancer is found,
Right.
be it breast, cervical, or a colorectal cancer,
Right.
we will pay for treatment.
Okay, that was my
So
question.
we're not going to diagnose you and send you off, oh yeah, you have cancer, good luck
Right.
with your treatment. We're going to provide a treatment plan for you.
Good.
We have nurse case managers at the office. We have a wonderful administrative director who will get the patients lined up with the treatment that works for them. Support them. Go with them to an appointment if necessary.
Oh, wonderful.
We know how important support is. Not everyone has it. So if they need a little encouragement, need a hand to hold, we are there to walk them through that process.
Okay.
And we
great.
never let our patients go, as Meredith knows. She's been with
Absolutely.
us for 9 years.
Absolutely.
Wow,
Yes.
wonderful. You have
Yes.
that a great support system.
Yeah,
so
that's the
important.
answer to one of my questions, because I was going to ask about a support system for the patients, you know.
We have a support group monthly, every fourth Thursday from 12 to 1:30 in the Learning Center downtown at University of Maryland. We encourage anyone who's listening who doesn't have a support group, we do have a breast cancer support group.
It's the Living and Loving Life Breast Cancer Support Group. And again, as Rhonda said, we meet for fourth Thursday of every month. It's free. We'll provide lunch and different topics to help patients work through whatever it is that may be going on.
Thank you so much for that. And I don't know what happened with the doctor, but I did compile a little bit of information about the prostate cancer awareness. So I want to move into the prostate a little bit, and then we're going to go to cervical because time is running out. Prostate cancer is the second most common form of cancer affecting men in the United States. An estimated 241,000 men will be diagnosed with prostate cancer in 2012. More than 70% of men diagnosed with prostate cancer each year are over the age of 65. Some of the, a lot of times there are no symptoms, but sometimes when there are symptoms, it's frequent urination at night, difficulty maintaining a steady stream of urine, blood in the urine, painful urination. 2/3 of patients have no symptoms. If you have a family history, please get checked out. Let's go on to cervical cancer. Let's talk about that a little bit. First of all, what is cervical cancer?
Well, cervical cancer is every woman has a cervix. We have a uterus, a cervix, and the cervix is usually the beginning of the entrance into the uterus. This area is very common to collect diseases and all kinds of bacteria infections, and so the cervix can. And what happens is we encourage women to have a cervical exam yearly. I know some of the guidelines are changing, and I'll speak to that a little later, but we're encouraging ladies to get a cervical exam in which the doctor will do a speculum and use a little swab and scrape the area of the cervix, send it off to the lab and then the lab will report back whether or not it's satisfactory, abnormal, or has indicative of HPV.
Does the presence of cancer cells mean that a woman has cancer?
The presence of cancer cell normally does mean the patient has cancer. It depends on what stage.
Okay.
There are 4 different stages.
We have Miss B who's on the air now. Hi, Miss B.
Good morning.
Do
Good
you
morning,
have
Miss B.
Do you have any Do you have any questions for our guests, please?
Just wanted to say, I am dealing right now with a family member that has cancer, and it's such a devastating disease, and just whatever, all the information that can be provided, and we can encourage other people to go and be checked out, is just of the utmost of importance.
Yes, thank you so much, Miss B. Is it hereditary?
Breast cancer can be there
Or
is-
cervical?
or not
Cervical cancer.
not for cervical.
Okay, it isn't hereditary. Okay.
Actually, cervical cancer now, they're actually saying that it's an STD, a sexually
really?
transmitted disease, because 97% of the cases of cervical cancer are caused by the HPV virus, as
Right.
Rhonda mentioned, which is
Right.
the human papilloma virus, which is sexually transmitted. Now, there are many strains of HPV. All of us have had some strain of HPV, male or female, at some point or another, but there's certain strains that actually can lead to and cause cervical cancer. Unfortunately, most of the time it's the women, we will receive the HPV virus from a man, but they don't have any symptoms. And it doesn't turn into anything for them. But for us, those same strains could turn into cervical cancer.
Okay. This show is being sponsored by Coiffure Exclusive Salon. We are a private salon. We offer hair replacement, hair extension services, and if you're transitioning from relaxer to natural hair, you may want to call us. The number is 410-663-2643.
COIFFURE.
Coiffure Exclusive.
That's where it's at.
Okay. Is there any way risk can be reduced for cervical cancer? Because I know you kind of hit on that a little bit.
Annual screenings.
Okay.
Your screenings. Now, of course, there are changes that are happening now, because what they're saying is if you've had a screening and you're negative, you could wait 2 years and come back. Right now, that's what my program is doing. If you have had for the last 3 years, negative screenings, then we're going every 2 years, and then your third is 3 years, and then you go back 2, 2, 2, and then 3.
Wow.
Okay.
Okay. Ms. B, did you have any more questions? Or any questions or comments?
I was able to get on, so
Okay.
listening. So.
Okay. Kevin, do you have any?
Well, she answered my question as being a man, and I wanted to know about breast cancer. I thought it was a ridiculous question for a man,
No,
but
not
you
at
know,
all.
It's ridiculous.
yeah, okay. So that was pretty much my concern, about how it would affect men, Mm-hmm.
Did you have anything else that you wanted to add before we close?
410-328-HOPE is our number. If there's anyone under the sound of our voice who may not have insurance, underinsured, if you need a colonoscopy, breast exam, pap smear, mammogram, 410-328-HOPE. That's 410-328-4673, a Baltimore City resident.
Okay. Next week's show is going to be a show that you are not going to want to miss.
Yep.
So you make sure you tell all your friends, neighbors, everyone. We're going to be making history next week.
Mhm.
It's going to be an incredible, incredible show. Right, Miss B?
Oh, yeah.
Because we talked about it.
I'm waiting to hear it.
Yeah, so make sure you tune in next week, next Monday at 11 o'clock.
Mhm.
Shop Talk with Cassandra. Renee will be making history.
Because also, when you get online, go to our website.
Right, talkwithcassandra.com.
Mhm, it
And
is
make
off the
sure
chain.
you like us on Facebook, please.
Mhm.
Talk with Cassandra. Shop Talk with Cassandra Renee. And also, we have an opening for an insurance agent. So we're going to have that information on our website as well, because we are running out of time. But it's a local insurance agent who is currently hiring. So that's always good as well.
Yep, job opportunity. That's great. Yeah.
All right, so I guess this is the close of our show.
Already?
Already, wasn't it fun?
It was nice. It was fun. I think we may have saved some lives this time
That's
too.
right. Thank you all for joining us. And until next week, bye-bye.
Thank you.
Thank you.
All right. Thank you.
That was great.
Mm-hmm.
That was very good, very good.
Yay! Y'all want to say anything to the camera while we up in here? before we go off?
Thank you for allowing us to come.
And remember, ladies, early detection saves lives.
Ditto.
All right.
All right, take care.
All right.